Good afternoon, dear Venerable and dear friends. ใช้ไหมจ๊ะเป็นเลือกเป็นไหมเอาเหรอคะยังไม่ได้เลือกยังไงนะคะอ๋อCan you hear me better? Okay.
ก็ได้ยินแต่ไม่ค่อยเคียงสาวเริ่มถูกเลย
It's better now.
โปรอาจารย์เลือกไมโครโฟนแล้ว
Microphone. ผมใช้ original sound
ไมโครโฟนแล้วนี่เป็น
KT ทั้งหมดเลยใช่ไหมคะเดี๋ยวนะคะมันจะมี
จุดสปีกเกอร์เอาเป็นเฮดโฟนของอาจารย์ก็ได้ดีกว่าอาจารย์
อันนี้เป็นyou know breathing in I know that I am breathing in breathing out I know that I am breathing out okay okay I discussed with Dr. Suthida that we will change our format a little bit in this afternoon. So we will begin with the deep relaxation, which is the from our study. We use it in cancer patients to reduce their pain and their fatigue, tiredness, and it's proof that based on the foundation of mindfulness and practice of using the mindful breathing, we can scan our body, calm down our body, and reduce some pain and in cancer patient, and is from our brain that reaction of our brain to the we have stress. It proves that we can reverse the effect from the stress process that affect our body. We can reverse that process by using the deep breathing or calm down our nervous system by using we breathe deeply in and out, and we can gain the oxygen from outside to our body. That oxygen is the important requirement for our prefrontal cortex or the front brain, which is the part of the brain that relate to rational thinking, and we suppress or reduce the activity of amygdala, which is the part that promote the activity of the fight or flight or freeze response or survival response. That if we prolong that kind of response, will cause some not useful effect to our body and mind. So this is be like a small workshop for us to test the deep relaxation guided by myself. So I invite you to sit relaxingly. You can lean on your chair. You can adjust your position, which is make you feel more comfortable in your chair. And for our friend who is at their home or in the place that you can lie down, have a space to lie down, you can lie. And this is just the invitation for you to, if you find some place that you can lie down, you can. It's okay. This is the safe space for you to do anything to taking care of your body. Okay. And you can close your eyes. Close your eyes. Relax your shoulder. You place your hands and your arm relaxingly. Maybe rest your arm gently. Let your leg move. Because allowing your body to rest is very important. When your body is at ease and relaxed, your mind will also be at peace. And this deep relaxation practice is essential for our body and mind to heal. This following guided relaxation may take us for about 45 minutes. Feel free to follow the guiding words or just let it pass through your body like the Dharma rain. The most important thing is to enjoy your breathing and to relax during this practice. You might hear the sound of the bell during this practice, and also you might hear some songs. Please follow your breathing and relaxing your body while listening to these additional tools of this practice. I will invite 3 sounds of the bell, and this practice will begin after that. Breathing in, I become aware of my in-breath. Breathing out, I become aware of my out-breath. In-breath, out-breath. Become aware of the surface underneath you and allow it to support you. When you breathe in, you know that you are breathing in. And when you breathe out, you know that you are breathing out. As your abdomen rising, when you breathe in, and your abdomen is falling when you breathe out. Breathing in, my abdomen is rising. Breathing out, my abdomen is falling. Rising, falling. By breathing in and out, now you can generating the energy of mindfulness. Think about your eyes and smile to them. Allow your eyes to relax. Let go of the tension in all the tiny muscles around your eyes. Sending your love and gratitude to your eyes. Say to yourself silently, breathing in, I am aware of my eyes. Breathing out, I smile to my beloved eyes. Breathing in, I let go of all the tension in all muscle around my eyes. Breathing out, I send my love and gratitude to my eyes. Allow your eyes to rest and roll back into your head. Take the time to allow your eyes to rest deeply. You can gently raise your eyebrows to help release any tension you may be holding around your eyes. Breathing in, become aware of all the muscle of your head and your face. And breathing out, allow all the muscles to relax. Send them your tenderness and care. Breathing in and out, feeling them relax more and more deeply. Breathing in, bring your awareness to your shoulder. Breathing out, allow your shoulders to relax and release any tension on your shoulders. Let all of the tension from your shoulders sinking into the surface underneath you. Breathing in, become aware of your hands and your arms. Breathing out, allow your hands and your arms to fully relax. As you breathe in and out, take the time to appreciate your hands and your arms, sending them love and smile to them. Your hands and your arms is right there for you, and it allowing you to hug someone else, to help and serve others, to work hard, to do so many things throughout the day. Breathing in and out allows your arms to rest completely. With each out-breath and in-breath, feel the tension leaving your hands and your arms. Feel joy and ease in every part of them, and allow all the cells to rest deeply. With your energy of mindfulness, embrace your heart and smile to it. Sometimes we have neglected our heart by the way we have worked, eaten, and managed anxiety and stress. Our heart beats for us night and day. Now it is a time that we will embrace our heart with mindfulness and tenderness, reconciling and taking care of our heart. Say to ourselves quietly, Breathing in, I am aware of my heart. Breathing out, I smile to my heart. And breathing in, I am taking care of you, my dear heart. Breathing out, I allow all cells in my heart to relax deeply. Breathing in, bring your awareness to your legs, your feet, and then your toes, high toes. You might enjoy wiggling your toes a little bit. Relax all of your muscle, letting the tension flow away through your toes, through the surface underneath you. Breathing in, I relax my feet, my legs, and my toes. Breathing out, I smile to my feet, my legs, and my toes. Breathing in, wiggling toes. Breathing out, smiling toes. And now I invite you to using the imaginary ray of your mindfulness to be aware of the body. Attention to each part, embracing it, and sending love and care as you breathe in. Of the body needs healing. You can spend more time embracing and caring for that part with your loving awareness. Breathing in and out, your whole body feels light, like duckweed floating on the water. You have nowhere to go, nothing to do. You are free as a cloud floating in the sky. Breathing in, I am aware of my whole body. Breathing out, I relax my whole body. Aware of body, relaxing body. And now I will play music for you. Please enjoy your relaxing and breathing for a few minutes. feathers in your hands when you touch without taking, and petals on your feet when you walk with joy. Music in your voice when you speak with laughter, and moonlight in your sleep when your heart is free. Reverence is the nature of my love, my love. Reverence is the nature of my love. Reverence is the nature of my love, my love. Reverence is the nature of my love. I bow to the bushes, I bow to the flowers, I bow to the singing birds in the trees, I bow to the mountains, I bow to the rivers, I bow to the dancing bees. I bow to the mountains, I bow to the rivers, I bow to the sinking deeply within. No more, no lotus, no lotus, no more. Not two but one, as breath and blood. No birth, no death, life flow through every breath. Waking up to a brand new day, everything's gonna be okay. No darkness, no dawn, my heart can sing this song. Mm-hmm. Mm-hmm. No lotus, no more, 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 no lotus, no more. Breathing in, I am aware of my whole body. Breathing out, I am aware of my whole body. Aware of my body. Relaxing my body. Please stay in your relaxing position, breathing in, aware of your abdomen rising, breathing out, aware of your abdomen falling, while listening to these three sounds of the bell. So now you can open your eyes and listen to your body. If your body tells you that they want you taking care of, please do what your body tells you to do. Maybe you would stretch your body a little bit. Yeah, if you are in the sitting position for too long, you may want to unfold your leg and massage your feet. Okay.
So that is a sample of the total relaxation, which is we can associate with the practice of anapanasati, one of the exercise that knowing, scanning your body, calming your body, relaxing your body. and also the adding of the music, of the relaxation music, is helping your body to stay in the relaxing position, activating parasympathetic system. And this also proven that it is a benefit in cancer patient. So you can see that when you practice mindfulness, it's just to realize the here and now. And then when you realize that you are in a stressed position or stressful situation, you have a tool to calm down your stressful situation. Bring yourself, bring your nervous system back to the parasympathetic part. And then Dr. Buntharika will show you how to riding the storm using mindfulness.
How can I share my screen? Okay. 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 So we are ready for adding more new information to our brain right now, I think. But มีวิธีให้มันเต็มไหมคะหรอทำยังไงอ่ะย่อซูมลงมาย่อซูมปิดก่อนได้ไหมไม่ย่อซูมลงมาย่อตรงไหนอ่ะโอเคย่อลงไปย่อตะกี้เอาใหม่นะคะ
ไม่เอาอันแบบนี้แหละแต่ว่าย่ออันนี้ลงไป
ย่ออันนี้ลงไปอย่างเงี้ยหรอ
ไม่ใช่หมายถึงว่าหุบหน้าต่างนี้ลงไป
หุบหน้าต่างนี้ลงไปทำไม่ได้ทำไงอ่ะI'm a kind of low-tech person, so please bear with me.
อันนี้เขาเปิดอยู่ใช่ไหม
ใช่แต่ว่ามันยังไม่ได้เป็นแบบไม่ได้เป็นแบบอันนี้โอเคแต่ว่าเป็นแบบนี้ได้ไหมอันนี้ไม่ได้ตรงนี้โอเค Okay, so we're good now. So I will talk a little bit about the scientific knowledge and how we apply with the mindfulness to help us in the medical field when we have a little bit how we define the emotions. The definition of emotion is emotions are complex, involving multiple different components such as subjective experience, cognitive process, and expressive behavior, psychological change, and instrumental behavior, which is so a lot of information, right? But so the thing that I want you to know that emotion used as a primary function on how we react to environment to increase the probability of our survival we use the emotion to trigger. Imagine that in ancient time, when we have some dangerous in our life, if our body and our brain is not respond properly, we will not survive, and we face like a tiger in the forest, something like that. But nowadays, this stimuli trigger is changed from the tiger in the forest into just like this, the stress in front of the monitor and my low-tech skill, something like that. It stir up my stress and activating my fight or flight or freeze mode already. Okay. And then this morning, Dr. Suthida already told us about the part of our brain already, but I want to emphasize that the part of our brain that is responsible for the emotion is the amygdala. The amygdala is developed in the time that we are in our mother womb. And when we were born, they also develop a little bit more, and after birth, they still develop during the time that we are born, and after that a little bit. Okay. And based on the scientific study, how our brain works when we feel something, right? How our brain works when we feel pain. In medical field, we are have more study on this pain, because we deal with the disease and many diseases causing some pain. So we want to help our patient to feel more comfortable. So we study a lot for the method to reducing the pain in patient. And pain is defined as an unpleasant sensation signaling actual or possible injury. And we can divide pain, classify the pain using the duration or using the cause of the pain, If we classify by its duration, we can have the acute pain or chronic pain. Acute pain which begins suddenly and does not last long, and the chronic pain is lasts long for many months or years. If we classify it from the cause of the pain, we have the nociceptive pain, neuropathic pain, and psychological pain. The pain of the body, the pain that from the nervous system, and the pain that our mind created, something like that, psychological pain. Okay. And then for the knowledge of mindfulness and pain, the study using functional and structural MRI to learn about the brain mechanism involved in mindfulness-related pain reduction. And the study showed that mediator has increased activation in the area associated with processing the actual sensory experience of pain. and also decrease activity in the area of our brain, which is the regions in emotion and memory assessment. And this is the diagram of the brain pathway. Okay. And this picture shows us the area of our brain involving in mindfulness meditation. Okay. So this is the information. These are the information that we can conclude from the study of mindfulness and pain. Okay, the first one is people using mindfulness meditation has a different neural pathway than and reduce pain intensity above and beyond the people not using meditation. And the second one is it can decrease the activity in some brain area, and so the pain information cannot be processed as much as usual. However, there are still many conflict studies that indicate the mechanism may vary on the expertise level as well as meditator engagement. Okay. So more research is needed on this topic. And so we can conclude that mindfulness can be used as an add-on therapy for chronic pain disease to reduce the pain in our patient from the scientific research study that I have mentioned before. And so I want to jump quickly to the next one is fear. Fear is the oldest and strongest emotion, play an important in the evolution, and is essential for when we facing the danger in ancient time. So amygdala is also considered the key structure in preparing an organism to react to danger, and oversensitive and overreactive of amygdala is the common feature of some disorder related to stress, fear, and anxiety. And from the research study, in dangerous situation, the amygdala's key role in the experience of fear and the fight or flight or freeze response. And it also important in the emotional memory, processing emotionally changed stimuli from the environment and reveals emotional significance to this information, whether it's relevant or not. Don't worry, I will give you my slide after I after this lecture. So overall, the research of mindfulness and fear show us about the structural and functional changes in several brain regions, and in association with the practice of mindfulness, that these brain regions are also responsible for research focusing on the disappearing of fear also. And then one, I think, that I want to mention is stress. The common definition of stress is focuses on acute challenges, as in the fight or flight or freeze response, and generally mentions mediator of only two of the interacting system that are involved, namely adrenaline and cortisol, which is not important for you to remember the adrenaline and cortisol. Just forget it. But please remember that the stress is the important part for activate the fight or flight or freeze mode response in our body. Is okay. Is enough to remember that for you to understand. The brain is the central organ of stress and adaptation to stress. So there are some changes in our brain when we have stress. If in the short term, these changes may be adaptive. So our brain can adapt for the changes. But if the stress passes, the behavioral state persists along with the changes in neural circuitry is prolonged. The maladaptation of the brain require intervention we have to help our brain in that situation, because they cannot recover from the prolong of stress, something like that. Okay. And this is this area of human brain which highly involved in the physiological response to stress. And this is the slide that conclude about when we have stress. The stress comes from environmental stressor, major life event, trauma or abuse. Then when we perceive stress, we have the different, we are different, so we have the individual differences. And when it's triggered, it's the physiologic response and behavioral response is followed by the stress trigger, and it has some adaptation and protection or damage. As I already told you, that if the stress is not prolonged, it's easy to be adaptation and protection. But if it's prolonged, it may be we have the damage to our brain. So we use the mindfulness to reduce the activity in the part of the brain called the amygdala, and by reducing the activity of the amygdala, mindfulness practice effectively reduce the breakdown of level of the stress. This is what we know from the medical field study. And this slide, I love this slide very much because this is a picture of compare to our brain neural pathway, because as Dr. Suthida said that the neuron connect to each other and communicate to each other, and it increase and it create the pathway when we face some stimuli and the information run out of from the outside, we receive it inside, and we the neuron communicate to each other, make the pathway from us to respond to that stimuli, outside stimulator. It's like we create the path in the forest. If we respond to that same stimuli frequently, it's like we walk into the forest that at first they are not the paved way yet, but when the neuron connect to each other and create the pathway of the response that we respond to the outer stimuli, it's like we pave the pathway in the forest. And when we respond to that stimuli the same way, more frequently, the pathway is appear clearly. It's easy to walk. It's like that. So if you want to change your neural pathway, you have to create the new pathway to the new connection of the neuron to create the new pathway, and you stop yourself to walk into the old pathway for a while. So the glass will cover the old pathway, and you can walk easier to the new pathway, something like that. So this is our hope to change our habit energy or our habit that not useful for us in the past. So if we want to change it, we can change it by using mindfulness to stop us to walk into the old pathway and start to walk into the new pathway, something like that. Yeah. Okay. And this is the conclusion that mindfulness can play an important role in increasing self-awareness, self-care, as part of an integrated approach to health promotion and prevention at any disease stage. So in our medical field, we add on the mindfulness to our patient that help them reduce the amount of the dose of the drug they use in reducing the pain, which is if we add on the mindfulness, we know that patient will decrease the use of their pain control drugs. This is good for their kidney and their body, and we know that the drugs of reducing everything have the limitation. If you use it, you might use it more and more and more, and your body cannot receive it anymore because it is overdose or something like that. So we add on the mindfulness help in that area to reduce the dose of the drug that our patient might use if they are not have mindfulness. And as Dr. Suthida said that when we have the strong emotion, we can calm down our neural pathway a little bit, calm down our neural pathway that reaction to that storm or that strong emotion. Why we have to reduce it? Because we have the amygdala, right? Which is the ancient, we call it the ancient brain, which and the frontal prefrontal cortex, the front brain, which is we call the new brain, that which is the area that the human being has more larger area in this the prefrontal cortex area in the more than the animal. So, but we are not lucky enough to that when we have the strong emotion, the amygdala, the connection between the amygdala and the prefrontal cortex of the neuron between these two areas. From the amygdala, there are more connection 10 times comparing to the connection from the prefrontal cortex to amygdala. So it's easier when you have the stress or the stimuli that trigger you, is the response will hijack by the amygdala, which is cause that you react from your impulse, react like animal-like behavior, because the amygdala will hijack the area of your brain that respond to the rational, we call it the rational brain. But the amygdala is not that kind of ugly like that. And we also know that if there are no connection between the prefrontal cortex, which is the front brain, and the amygdala, we cannot decide, we cannot making decision. We cannot making decision. You can analyze everything rationally, but on the point that you have to make this decision, you cannot make this decision if there are no connection with the prefrontal cortex area and the amygdala. Okay. So the thing that help us to be calm in the storm when we have the storm. First one, we return to our home, or we find a place that can protect us from the storm, right? And then we will close the window of the house and to prevent us from the wind, the strong wind that come into the house or the shelter. And then we will feel warm and safe in that shelter, right? So it's the same when we have the strong emotion inside of us. We will have to find the tools to anchor us in that situation. Imagine of the tree. If we are the tree, when the tree faces the storm, if you focus on the top of the tree, the top branches of the tree, you can see that it's blow way back and forth dangerously and violently, and you're afraid that maybe the top branches of the tree will be broken by that storm, right? But if you look on the trunk of the tree, you see it's so strong. It can stay stable in the storm. So we are like a tree. When we have the strong emotion, we will not pay attention to our thinking in the top of the tree or in our brain. We put our attention to our trunk, to our that means we breathing to our belly to stay strong when we have the strong emotion, until the process that the amygdala might hijack the prefrontal cortex is at the end, so we can calm down enough, so we can pick and analyze or find the answer from that kind of situation and solve the situation perfectly and rationally, instead of use our emotion to decide what we're gonna do when we have the strong emotion occur. And my beloved teacher also suggests that to practice with the community of practice help us to be strong, to be have a solid practice, and we can develop our practice on the path of mindfulness easier when we are with the community of practitioners. And in the community of practice, we focusing on the 4 pillars of daily life as we balance the study, practice, work, and play. And this is a suggestion, and the definition of the Sangha. The Sangha is a community with intention and practices that lead to living in harmony and awareness. And the Sangha, or the community of practice, provide a conducive environment to transcend our conditioning, a place where we can take advantage of role model to see and feel how things may be experienced differently through co-regulation, implicit learning, and a lot of safety and support from our friend in the Sangha. Okay. I think I'm in it here from my part, and Dr. Suthida will be add more information to you.
So beware of your body and your bladder. So we're gonna take a break so you can taking care and give a love to Okay, welcome back. And we're gonna give you a few more aspect. And I have an interesting question from the online friends that he asked that I have a question. When there is stress, the amygdala secrete more cortisol. I understand that mindfulness and breathing help stabilizing our emotions, but what about crying and expressing it out through crying? Will this help or will add on the negative of our body? So any emotion is it's a kind of energy. So when you have a strong emotion, it is very difficult to calm it down without the practice before, and you just cannot agree that mindfulness is helpful to calm the emotion down and you can practice right away. It needs practice and practice and practice. So I'm gonna switch gear and I show you this picture in the Buddhist psychology. Our teacher taught that there is a two layer of our mind is a store consciousness and mind consciousness. The store consciousness is store a lot of seed, anger, sadness, fear. Every emotion is there. And if in the Theravada, we'll talk about the 51 or 52 affliction, right? I'm not so you talk about affliction, kilesa, that 52. There is a good one, bad one, and neutral one. Huh? Um, slideshow. Okay, here we go. Can you? No? Okay, okay, here we go. So according to the Buddhist psychology, this seed of the energy, the emotional emoji, the what we call the mental formation, 52 kinds of mental formation is already there in our store consciousness. And when it has been activated through the sensory input like eye, ears, nose, tongue, body, and mind, this seed of mental formation will appear in our mind consciousness, which is the mental in our thought, and that make we feel. And with practice of mindfulness, it's just that we are aware that that happens, and with the energy of mindfulness, that coping with this kind of several kind of mental formation, we will know that we gonna react or have a verbal or action according to just the reaction, or we have the mindfulness that can analyze and act better. So and obviously we have the full foundation of mindfulness in Buddhist practice. You can be practice to be aware of the body, aware of the feeling, aware of the mind, and aware of the object of mind. So if you aware of your feeling, if you aware of your feeling, that you have the strong emotion already, whatever anger, fear, or sadness. If you practice mindfulness enough to know that you are in situation, and you can tell yourself that I'm feeling sad, I'm feeling angry. Right now, I'm feeling angry. We're not gonna suppress our anger. We just gonna tell ourselves that I know that I'm angry. And if I'm still angry, I tell myself that, oh, I know that I'm still angry. Let's try next time you have this strong emotion. Let's try tell yourself that how you feel. And believe me, because this is my shared experience. I test with myself you will see that your emotion is not that high when you know that what kind of emotion you have. It reduced probably in half already. And if you rethink about it, you burst up and you aware that, oh, I feel bad again. That energy will go down. It will not totally go away suddenly like that. But once you aware that how you feel at that moment, that energy surging will be reduced. And if you are aware that, okay, I'm in the situation that causing this feeling arise, you can have three kind of a way to deal with it. Get yourself out of that situation, and maybe you focus on I use my walking meditation. I walk and focus myself on the walking. So still aware that my emotion is still at that level, but I also walking. Sitting maybe if energy is so strong, it will not be. When you aware that your emotion is there and you reducing it, then you feel a little bit better. That's how it work. And then teach mindfulness more and more, you can detect it when the trigger of that anger or sadness is coming up. The quicker, the better, because the energy will not go too high. But in the person, don't think that that mindfulness will solve everything, because we are all the practitioner. My friend who is also the practitioner, she has once she has panic attack, and she called me that I feel so bad. I'm walking all the time. I said that, okay, you can go take the pills and then you come and walk again. So if the emotion, it already hijacked, the amygdala is already fire. You may need some help to calm it down first, and then you use mindfulness to calm it down further. You don't need to rely on the medicine all the time, but what is the limit. So don't reject, as I am doctor, don't reject all the medicine when your emotion is cannot control by just a practice. Maybe our practice is not strong enough yet, but in the future it will be. So we help ourselves a little bit first, but don't just rely on the medicine alone. Just we have to practice too. So next time we'll be okay. It's better. So if you have a sadness and the crying is coming, the emotions surging, and you cry, it's okay to cry. Just tell that, oh, I know I'm crying. I know I'm sad. And if I'm sitting here and I'm very sad, I maybe go out and walk a little bit. Crying, that's fine. I know I'm crying and crying and crying. Let's try by yourself what happens to your emotion. I can tell you from my own experience that this is very helpful to me. But other people different. So maybe you have to try it ourselves. One of the Buddha teaching is that the Dhamma is invite you to come and taste it, and knowing it yourself, testing it yourself, and then you will know what happens. You don't need to know just the knowledge. And the thing is that, like I said, we talk about the brain and mindfulness today, and we talk about what the scientists know about the brain and maybe related to the mindfulness. But all of this will not be helpful if we not practice, because we just don't want to know just what the brain change with mindfulness. We want to use mindfulness to help ourselves and other to feel better. Maybe in the future they know more about the brain, but if the knowledge is there but no practice, this will not be helpful anymore. I think that's the reason that all of you here, because you want to know the mindfulness practice, you want to test it, you can give it to other, you can tell it once you test it and it is helpful to you already. And this knowledge today is just as a supplement that when if anyone question in the scientist world question you what you're doing, I said that nowadays the scientist world is no contradiction with the practice that I'm doing right now. But actually, if you want to know the benefit, you have to test it yourself. You're not gonna have a benefit by just knowing that it is useful. So coming back, okay. Slideshow from the start. Okay, so I'm going to give you a little bit a sample of what we use mindfulness in medical field, and this is not all because I'm dealing with the cancer patient. So I'm going to focus on the clinical trial that involve the cancer people. Okay, so like I said, the Buddha already know that mindfulness, concentration, and insight is the energy that link together and it go together. When we have a practice mindfulness all the time, concentration born, and then insight happens. And I like the Chinese characters. I know that is very good because it's the mind in the present moment. The mind in the present moment is the pictures of the Chinese characters. That's the word for mindfulness. So mindfulness is the remember to be in the present moment and aware of something that happening in the present moment. So be aware of something. We can be aware of our breath, aware of our body, aware of our emotion, something like that. Aware of mental formation. And also there is a word right mindfulness because in the Buddhist we have a right mindfulness, right concentration, and the right in the Buddhist word is not the right as the right and wrong. The right mindfulness is the right in the term of useful mindfulness. So it is beneficial mindfulness, not causing harm. Something like that is not right and wrong, black and white like that. But the mindfulness in the term of right mindfulness, my teachers said that it is accepting, knowing it without at the beginning no judging or reacting yet. Okay, and conclusive and loving too. So this is the pictures that I show you already. And then coming back to the brain, okay? So we found right now we know that in the typical brain, our the blood is go through the frontal brain more and less on amygdala. But in the depressed brain, the blood go through the amygdala more than the frontal brain. So that's another clue that when you have a strong emotion, the brain function is the amygdala hijacking you. So the amygdala is useful because it help the animal, help us to survive in the jungle. So it seeks safety, is the protect self, and judgmental, right or wrong, something like that. It may distort reality. If the person have been bitten by the snake once, and he or she saw a rope, and she may run away without thinking because he didn't have a time to process that this is not the snake, But if it is a snack, it will be helpful for his life, right? So he can run from the danger. So the prefrontal cortex thinking is more analytic thinking. And when we use our frontal cortex, we can be more open mind and calm and accept difference. But like the Dr. Buntharika said that there is a connection between amygdala or the what we call the limbic system and the frontal cortex. And if it was destroyed, a person become unable to make decision, even though you analyze things, but you cannot making decisions. So amygdala also, and it is the emotional part of us, help us to analyze and then making decision. What is the benefit for us and for other? And actually, I think I didn't put it here. There is a connection. The lane is connect from amygdala through frontal cortex is 5 times more than frontal cortex to the amygdala. That means that we have a tendency to react with our emotion than the rational thinking. So I think, in my opinion, is that our task of the mindfulness practitioner is that we are paving another lane from prefrontal cortex back to amygdala, making the lane wider or at least more symmetrical. So we have the way to control our emotion, more analytic thinking. Because what happens is that when we have dementia, when we get old age, our prefrontal cortex will be destroyed first. And you can see that a lot of dementia people, they have this emotional lay-by and they have no rational anymore. And that is not their fault. The prefrontal cortex is already destroyed because of older age. So that's we have to be more understanding to the dementia people. But there is also a data that a nun that the 70s and 90s, I don't remember, and practice mindfulness. And when they get older, even the prefrontal cortex seems to be shrink according to the MRI. She can still function and make the emotional is calm. So that means that because of the practice for many years, maybe her pathway of the brain from the frontal cortex to the amygdala is very strong already. So when she get older and have that effect of the dementia brain, the effect is less. So that is also the benefit from the Buddhist point of view, and also benefit from the medical point of view. Um, so when we have a strong emotion, usually it is very, very suffering feeling, either anger or sadness or anything. So it's the way to escape is just like Dr. Buntrika said, that one thing you can practice breathing meditation or something like that. You can walk and then you realize that you have this strong emotion, and uh, and don't need to try to calm yourself down. Don't force yourself. Just accept it. Just accept that you have this strong emotion. My teacher said that you have to look at the emotion as your baby. Your baby is crying. You don't want to teach them to stop crying. You just want to hold him tight and calm him down by your love. So when your strong emotion happens, don't beat them that why I have this strong emotion. Just accept that, okay, I have a strong emotion. Don't try to find the rational thinking. Just be with that emotion, knowing that you have that emotion first. When it calms down enough, then you start rational thinking. Why I have this strong emotion, but not rational thinking when you have the strong emotion. So that mindfulness will help you that. you realize that, okay, I have a strong emotion, maybe no rational thinking right now. It just we have to be with my strong emotion at this moment. Okay, so back in 1920s, maybe you know this already, that John Kabat-Zinn, Dr. John Kabat-Zinn, he is the practitioner, Buddhist practitioner. He created the hospital-based program known as Mindfulness-Based Stress Reduction Program, or MBSR. And this program combined training of mindfulness with the principle of stress reduction. And this is, I show you how the program construct. So they have this group pre-program orientation, 8 weekly classes, 2.5 to 3.5 hours, and all-day silent retreat during the 6th week of the program, and daily home assignment, including a minimum of 45 minutes per day of formal mindfulness practice and 5 to 15 minutes per day of informal practice. And then they have also individual group dialogue oriented around weekly home assignment. So what is the formal 45-minute assignment for this MBSR program is that you can do the body scan meditation, yoga, sitting meditation, or walking meditation. Okay. And what is the informal mindfulness meditation in the program? Try to awareness of a pleasant or unpleasant feeling, and you have the assignment for 5 to 15 minutes, aware of the breathing, aware of routine activity, aware of eating, driving, or what are you doing during the daytime. So, and the principle of this program is the practice to be the adventure. Like I said to you, that you try, when the unpleasant feeling happens, you try to catch it and see how long it lasts. Maybe it's fun to see that, okay, this time it lasts for 30 minutes and next time it will last less or something like that, or last more. So it's not a chore. So it's just like you are in the adventure. You practice, or you make observation within yourself instead of the scientists that make observation to outside world. You make observation within yourself, and emphasize on the importance of individual effort. And then it's like a lifestyle changes when you practice this. And it is emphasized on the awareness of each moment, when you walk, when you talk, when you eat, something like that. But in the beginning, it take your effort only 5 or 15 minutes a day of the 24-hour a day. So it's not that much. So if you, in this program, you have to commit that you just need this 5 or 15 minutes a day of try to aware of what happens in the present moment. And it is like an emotion educational program. In that first group, it has many kind of patients. So it's not only one disease control group. A lot of mixed patient with different disease or different problem. So that is how we practice in Plum Village as well. One practitioner asks what we taught. We just think that we taught the Thai answer is that we teach how to walk, how to eat, how to sit, how to lying or sleep or lying down, something like that. So, but with mindfulness, not spontaneous. So from that MBSR program, there is a lot of variation of the program in different medical field. For example, MBCR program is the Mindfulness-Based Cancer Recovery Program by Dr. Lida E. And so there is some adaptation. Like It also the 8 weeks program, but the group meeting is less from 2.5 to 3.5 hours, only 1.5 hours. The home formal practice is 30-minute meditation, something like that. So a little bit variation in the practice, but the core principle is about the same. And mindfulness has been used in this kind of cancer patient because the coping with cancer require emotionally focused strategy to deal with this disease. Okay. And because in the Buddhist mindfulness practice is, like I said in the former slide, the previous slide, that it accepting things as they are without judging or reacting, without pushing it away. It's just accepting it first. Even there is a difficult emotion like fear from cancer, embracing it, that just tell yourself that, okay, yes, I'm fearful. I'm not trying to be a brave one, that I'm okay. I'm not okay. So I know that I'm not okay. I don't feeling okay. I feel not so good. Accepting it. That is mindfulness, true mindfulness. And then people found that after practice and into this program, the people become less worried about the future and less suffer over the past. They can be more and more be in the present moment and can be happy or at least calm at the present moment, even though they still have cancer. So it is proven in the scientific world, in the statistically, that 65 and 35% improvement in mood and stress symptom when compared with the control group who doesn't practice mindfulness. And this practice, the benefit maintained even 6 months later, because when the patient in this program, even though after finish the 8 weeks program, they found that it has benefit. And a lot of them continue to practice even the 6 months later. And then that is the purpose of the Buddhist teaching. We don't just know for the sake of the knowledge. We want it to help ourselves and humankind, right? So that is the basic of the program. Okay. So it concludes that the program provided tools of self-regulation and introduced the new way to look at the world, which is the result of original Buddhist philosophy of the program. So nowadays in the medical world, we have some proof that the patient who practice the practice, even though they are not Buddhist, because the Buddha didn't create any new thing, he just discovered thing and tell us. So even they are not the Buddhists, most of the patients in this program are not Buddhists, but they practice the way that the Buddhist practitioner known to practice, then they have the same benefit. And there is many, so I will not go into the detail. Besides that MBCR program, there is also a variation of this adjust MBSR program in the other author. They do the research and all these things. And all of them, I would say, that showing some benefit, like this one shows significantly decrease in stress and post-traumatic avoidance symptom and increased positive state of mind. And 6-month follow-up in this program, 38% of participants continue to meditate regularly or still practicing it. they are go on with the other cancer type group. They try to control the environment, give the same group of patients. Like the first was a mixed group of patients. Now is only focused on the breast cancer patients. So the bias is less or something like that. So I would say that they all the same conclusion. Guys benefit from practice mindfulness. And you can see that it's not very demanding because in the group of program is they are only touch the basic of the beginning of practice only. And they also, after 8 weeks, they also get the benefit already. So it is very strong benefit that nowadays we even have the journal of mindfulness. So mindfulness in the medical world can apply to many disease and field. Okay. Like this stress mindset program, I'm gonna go very quickly. There is some trial that concentrate on insomnia, unable to sleep. Okay, and then at that time they compare the mindfulness-based cancer recovery program to cognitive behavioral therapy for insomnia, CBTI, which is the tools for the psychotherapists, the standard tools at that moment, and to help with the insomnia. And the mindfulness also non-inferior. So you can also use mindfulness to help with insomnia. And in some people, they try to get the biologic outcome. And they found that there is, in people who practice mindfulness, they shift in immunoprofile to a healthier profile as well, lower evening cortisol level and decrease in blood pressure, for example. But like I said, it's not the mindfulness practice, and it's like our body is complex system and linked together. There is nothing to be stand alone. So when you change one thing, like you practice mindfulness, the cascade downstream will be gradually changed as well. But you cannot think about it as a one effect. Okay. So other mindfulness meditation, like you experience the total relaxation, is a relaxation technique as well. Okay, so this is a total relaxation practice. I did, and Dr. Buntharika did the test on the in layperson and patient with cancer, and also it has a statistically significant in some of the symptoms when you use the total relaxation, which is the mindfulness to relax your body. So it has some benefit. And even for American Society of Clinical Oncology, which is the big American society for oncologists, the doctor who treat cancer, it also give mindfulness is the best approach as a treatment option for cancer survivor with chronic fatigue. So they don't have a lot of evidence in everything yet. So at least fatigue is helpful, and they become the standard recommendation that you can use mindfulness for fatigue patient, something like that. So you can see that will be proven more and more that it is more beneficial. So I think we are Buddhists can be confident that mindfulness practice, if you practice, it will eventually helpful. And then we also test in the Dr. Buntharika said that test in our healthcare provider. You can use with the patient. You can use with the healthcare provider. They become more self-compassion. And then when we are aware and understand more of ourselves, taking better care of ourselves, we have more kindness to give to other. So it is very important, especially we are mindfulness master, right? That you have to practice yourself. You have to be happy, so you can give the happiness to other, to the new learner. So I'm gonna finish now, and then gonna be question and answer. Any question? Feel free to share,ค่ะ, if you want to share your mindfulness practice, because of course we are all practitioner. I'm on my practitioner path as well as yours, so you may experience more than me in your practice. So you can share what happens to yourself and what is the difficulty, what is the successful that you're happy with the mindfulness, your mindfulness practice. I have since 2007, 2008. Yeah, we have we call Sangha in Plum Village. So we have the Sangha in the hospital. We have originally meet once a month to practice together, maybe an hour, uh, practice the meditation together, and then sharing. Like actually, it's just uh, like a MBSR program. We sharing our practice on the previous month together, and what is the difficulty, what is helpful, something like that. Then later, because of our members think that once a month is too long. So now we become uh, 2 times a month. And then she create another group in her hospital, which coming together once a week, like like a MBSR, but we are non-stopping group. So we are continue with that practice up until now, but we don't demand people to come. People can come and go as they please. Some people come and then they leave for a while, they come back. They know that we are there. So we are just like a temple. We are welcome when the people need us. So but there is no teaching. I mean, because I'm not the the one to teach. I think it's a sharing practice among our practitioner. In Thailand, I think that in the term of psychotherapy, I think it has been applied. I'm not the psychotherapist, so I don't know. But actually, because Thailand is the Buddhist country, it is very easy to talk to the people about mindfulness practice, and maybe if they have a question and they need help, I can share myself. And even if the patient is not the Buddhist, Christian, or Muslim, I share because the one patient asked me, because he said that, oh, I'm feel very angry with my wife. And then I asked him what to do because he is a cancer patient. He said that I go out and walk. So I said, okay, that's very good. That's very good already. You know that you are angry and you are not doing anything to your wife. You just go out and walk. Maybe next time when you walk, you can just breathing in and you think of Allah. You can walk with your Allah. So, and I asked my friend who is Muslim already that, am I okay with this? And he said, okay, it is recommend it. You can use that. And so you can use the technique with any religion. So far with my patient that you have different belief, I don't see any contradictory with practicing mindfulness at all. The question from the floor is related to 45 meditation that we did. I had a strong clenching in my eyes for a while, and would you think that the nerve dryness, or you can accept the idea that is the third eye energy? So I would share my own experience. So I was ordained once as a novice in a plum village tradition for 3 months. And when I sit for a while, I feel something crawling in my shoulder. So I asked my mentor that I feel like an ant crawling in my shoulder, what to do. And she said, are you sure that there is no ant? Next time when you wear your robe, just make sure that there is no ant. So sometimes that is a true ant, but sometimes there is no ant. So I like, okay. So I just feel it. I just accept it that I feel it. Just like, okay, I feel an ant crawling. And then after a while, it disappear. So that is my true experience. Maybe you have to check first when you feel something like my mentor said. I feel like, okay, I have to check my rope is no ant first, something like that. And it may be either way. Maybe your nerve is tired or you may have a third eye energy or something like that. But the Buddha said that when you have something in the meditation, you just accept it and let it go and come back to your breathing. Don't dwell in that extra things. Even if you have seen things, the teaching, I think in Mahachulalongkorn MCU is also you aware what happens and then you let it go. So that is I think that the basic practice. So as a practitioner, so I do like that, and I have a strong feeling, and then I just stay with it and observe it, something like that. So one time I feel really depressed after strong emotion occurs after practicing walking meditation, and I aware that it has happening. So I asked my mentor at that time, and he said that, "Are you sure that uh, you didn't expose yourself to something that triggered this?" And I said, maybe not. I didn't aware of it. Since that, I choose to just stay with it and not try to think what triggered it. Stay with it, and it lasts for many days, and then suddenly it just like that. I just aware that what happens. So that is a wonderful feeling when I realized what happens. So sometimes the emotion comes and you may not have the rational explanation why it comes. So you don't have to explain it. Just stay with it. and then maybe the reason will come later. You know it later what happens, but don't try to push yourself to find the cause of it at that moment. That is my own experience. So maybe some of you have other experience how you deal with it of this kind of thing. What about Bob? Something happens during the meditation.
Still the same question, right? So, as Dr. Suthida said, that when something happened to us when we practice meditation, as a practitioner, I will come back to the first thing that bring me to the practice, which I have my intention to be an observer. So I make my curiosity about that, what it look like, something like that, or not name it yet, but observe it, and then when it change, I can observe it, and I realize that it just happen, stay for a while, and then go. It's like the boat flowing, passing to your eyesight, and so don't jump into the boat. Something like that. The boat will passing through your view, and then it go. It's like that. But if you feel that that boat is kind of fun to join or to jump in, it's okay too. You can jump in for a little bit, and when you realize that, oh, I am in a boat right now, you can jump out onto the riverbank and forgive yourself as the observer that, okay, it's too fun, so I jump in a little bit, and then I already jump out and be the observer right now, and I observe the other boat, something like that. So make it fun to your practice, so you can practice for a long time without boring.
So as a scientist, I feel that Buddhist practice is fun. You know, that the scientists have to watch that bacteria growing in the plate for a long time to see what is the changes of these bacteria colonies, you know. So I make it fun to observe my feeling. So I think it is very fun, even though I feel bad. I feel like I observing the rise and fall of this, and then I can see if, oh, it did fall, and now it's going up again. Something like the way I'm doing with my plate. So it's kind of become an observer, something like that. So I kind of feel like I'm still the scientist practicing the Buddhist observation and practicing mindfulness. And there is another question is that my difficulty is finding a sangha to join on a weekly basis. And sometimes I find it hard to practice on my own. Welcome to our Sangha. So you can come join the Sangha. We have now, since COVID, we become online. So we have we call it half moon Sangha. So we meet online every half moon, but don't have to know when is half moon. And it is 6:30 p.m. to 20 p.m. And so we're going to practice sitting a little bit, reminding the mindfulness training practice and sharing, something like that. And another thing that you can do is that you can create your sangha yourself, because when we begin, we have only 2 persons. And it's not the sangha who serve, because the sangha is to serve ourselves. So we know that it's difficult to practice on our own. So we find create the Sangha to help our practice. Even though there is only 2 person, we still practice. But now we have many, 10, 30, and one time we get the offline meeting, and one time we have almost 100. So I think that when you create Sangha, you make it your commitment yourself. Maybe just get one friend to practice together in the regular basis is enough. And then when you have that regularity, you can tell other friends if they want to join. And then you surprise joy, and you don't be discouraged by friends come and goes. And it's just like that, oh, we have only 2 person now, we're not going to do it. We still do it because it benefit us more. Something like that. So I encourage you to find a friend to have your own practice together as a Sangha, so you can encourage each other.
My difficulty is sleepiness, and I fall asleep in total relaxation and people that I fall. I think this kind of practice will make deeply for sleep if I practice like that, because I'm very easy to fall asleep. I want to meditate.
So total relaxation is just in the lying position is very good for the patient because they don't have energy, and we don't encourage the people to fall asleep. But we are not blaming people who fall asleep either, because we tell that if you fall asleep, meaning that your body is very tired, let them rest. So at least when you wake up from that deep sleep, with the mindfulness practice, deep relaxation, you feel fresher. So in the total relaxation, we are not blaming or not fall in the people who fall asleep. We allow them, but we don't tell them that I want you to fall asleep. If you be able to practice the meditations, body scanning, follow the body, that would be great. And also, if you fall asleep easily when you do meditation, maybe you can change to walking meditation. It's just like the MCU teaching there. Doing sitting first, and then
with everything that happened. And when you lie down with a lot of friends around you, and sometimes you hear the snoring, I advise them that please think of the noise of the snoring as your extra sound of the bell that bring you back to your breathing and your body, and it helps to in that kind of be friend with everything. Yeah.
Okay, I think this is the time. Is the 3:30? So should we listen to the sound of the bell and finish our class today? Any heart-burning question that if you didn't not sleep? Ask your last chance to ask.
Okay, so shall I ask a question?
I don't aware that there is a side effect of mindfulness um, in the epilepsy people. The question is that is there any precautions if the patient have epilepsy and practice mindfulness? I don't aware. One of my friends, he has brain tumor and he practice. He is practitioner, very good. And he was driving and that his leg is start jerking. And then with mindfulness, he immediately pushed his car to the curve. And that is luckily to be in front of the hospital. So he put his car into the hospital and stopped and he start convulsing there in his car. And he survived because of that, because he aware of his body and 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 that is already because otherwise if he convulsing while he drive accident already he may die from the accident because he aware of his body immediately he pushed the car to stop in the safe place. So I think that it is more beneficial. There is maybe some people data that meditation, long meditation, just one pointed meditation, maybe in some people who have depression, maybe have not helpful. I would say I would not say it harmful because I think that when you are concentrate enough, your burning emotion that you suppress for a long time is coming up. Is coming up. That happens to myself, and that's why being with our teacher when that happens, and the way that my teacher told me is that to aware, just to aware, don't push away, just be aware. And if people ask me at that time how I feel bad, I feel bad, I feel sad, but I am aware that I feel bad and feel sad. And this happened, like I said, a week, more than that. Is I'm stay with this feeling. And one of the practitioner at that time asked me if I'm afraid to be lost in this depressive emotion or not. And at that time, surprisingly, I'm very confident because I'm a confident practitioner. I said, no, I think that the way the teacher teach us, I confident that I'm gonna be okay. So I just stay with it, even though it is a very strange feeling at that time because I'm the one who feels sad, but I'm the one who observe me feeling sad. And they think that the one that observe me feeling sad that helping me to be still rational. That is a very, very strange feeling. I don't know what the term because I'm not the monk or the nun and not learning the Tipitaka a lot. But after past that emotion, now I'm feel very confident. Any kind of emotion comes, I think I will survive it.
And there is the question from Zoom. Today is a beautiful class. I want to ask the final question. In the apply mindfulness, are there cases where effective? I can say that mindfulness normally useful. You have concentration, stay mindfulness long enough, immerse you in mindfulness, and you have to focusing on the same thing at the same time for a long time, and you have a strong concentration. Is change the neurotransmitter in your brain, and if the person have an imbalance of the neurotransmitter in their brain, which is we uh, we we know that person suffer from the bipolar, have some that effect in their life. So in that case, the concentration, we focus one point, concentration is not useful for that kind of patient who suffer from bipolar, which they have that imbalance neurotransmitter in their brain. So be aware of it when use. But the short mindfulness is helpful in any case. So you can use mindfulness in any kind of disease. Yeah, yeah.
Okay. Listen to three sound of the bell. Thank you, Ka. I will give the slide to the Venerable, and then he can distribute.